Joint pain is caused by a multitude of things. Former injuries is something that we see very commonly. You've damaged your cartilage. A lot of times it happens when people are young. That cartilage damage starts to break down over time. Less cartilage you have, the less space you have, the more inflammation, more friction that happens inside the joint. When that inflammation takes place, it basically sends a signal back to your brain that elicits pain. Typically, the worse the damage is, the worse the arthritis is, the more pain we have.
Every step you take when it comes to your hips or your knees, so obviously your body weight plays a role, simple physics, chosen activities like high-impact sports versus, biking and swimming, which is kinder on the joints, injuries like meniscus tears, ACL tears, and the like, fractures that go into the joint, all those things damage the cartilage and can accelerate the degeneration and breakdown of the cartilage, which is essentially what arthritis is. There's a lot more grinding with shoulder movement. The ball stops being shaped like a sphere and starts to become more like a mushroom and eventually almost square as the bone spurs deform that. And that can be problematic. I've had 2 shoulder replacements and they were wonderful, but I put it off for almost 2 decades, before finally getting something done. So,
people that don't move a lot, that are very sedentary, they actually tend to have a lot of joint pain because their joint gets stiff and swollen if it's not moved well enough. Depending on their medical conditions, they can have a lot of disuse, atrophy of their muscles. The heart isn't maybe pumping as well as it should. And so you can get a lot of edema and swelling in the lower extremities, and so when you stand up to walk, it's very painful.
When trying to explain to a patient why their knee hurts so badly when it's arthritic, I try to explain the structural changes that have occurred in their knee, and then this concept of inflammation, which is a big concept. Inflammation means that there is pain because pain chemicals have been released from your knee and irritate the nerves. There's swelling, there's warmth. Your knee is wearing out. The parts are wearing out. The surface, the bearing surface, which should be smooth and soft, has become rough and ragged, and it goes in stages. It might just be a little fuzzy like a tennis ball or a peach, and then it will start to lose more cartilage and become pitted like a golf ball, and then pieces will start peeling like an orange, and then it's down to bare bone. And when it's bare bone, you have no padding at all. The pads that you were born with, your meniscus cartilage, wear out and get ground and macerated and squeezed out from between the bones and no longer pad. That pushes on the ligaments. All of this induces inflammation within the joint lining. So this whole joint is wrapped with a balloon full of joint fluid, and that joint fluid has chemicals in it that actually hurt. The joint lining gets thick, and so when you sit for a while, your tissues get stiff, and you have startup pain when you get up out of a chair, get up in the morning. You have to stretch out all those thick, sore tissues. The muscles are affected by that inflammation and weaken, so your knee isn't as strong when you try to go up and down stairs.
Definitely not one cause for joint pain. Sometimes it has to do with tendons and ligaments around the joint. Shoulder, very common. You can get inflammation. You can get something called shoulder impingement, not necessarily arthritis, where you've got just a chronic inflammation going on that causes pain, and the joint may be completely normal, no signs of arthritis. So we see different types of tendinitis around the knee. We see tendinitis around the hip as well. So a lot of times it's not just arthritis. There's other things that can cause pain.
So there's this constellation of structural changes and chemical inflammation that causes various types of pain. Sharp pain when you're bone on bone, aching pain because your tissues are thick and warm and inflamed and don't stretch as well as they should. So you have startup pain. It hurts in the middle of the night, every night, and these pains get worse with time. And we try to minimize the pain with different medications and ice and stretching and strengthening so that you're not weak and stiff. but eventually it becomes end stage, and that's when you need to consider a knee replacement to give you new surfaces that don't induce inflammation, and so the tissues get softer and more limber and don't hurt as much.